we're celebrating our collective experience within the South Texas Health System with the Da Vinci robot, specifically the D5, which is the newest installation of the robotic platform.
I know in the industry the Da Vinci brand is very popular, very well known, very trusted, but you've got the latest and greatest version of it, correct?
Correct. Yeah. So it has about 10,000 times the computing system of the average robot. It has a lot of additional features, preferably, ergonomic features, adjusting the height of the console for the robot, the robotic surgeon. It allows you to have a replay of your robotic experience, so you can actually go back and rewatch all of your robotic videos. It even breaks down the different steps of the surgery for you, so it highlights all of the different steps of your dissection, so you can share it with colleagues. You can go over critical steps if there was any concern, and just kind of learn and continue training on the platform.
How easy is it to learn how to use it? Do you have to be a computer scientist to understand it all?
I think there's been a heavily perpetrated lore that surgeons who did used online gaming systems have some facility with transitioning to laparoscopic surgery and then robotic. I dabbled in it, but I wouldn't say that I was a heavy user of any sort of video game platform. And I think it's just like anything else in adult learning. It's just repetition, and then the motor skills kind of follow naturally. So
you're a big advocate. You're a fan of the robot. What about your colleagues?
I think that for the most part, at least the colleagues that I've encountered will have some preference for using the robot. I think there are some who feel more comfortable with, laparoscopic or open surgery. I certainly don't demonize any of those other approaches. I think there's a time and a place for them, but I do think that in the advent of sort of advancing modern surgical techniques and best outcomes for patients, I do think that the robot is state of the art.
I'm guessing the patients don't know anything about it. I mean, perhaps afterwards you tell them that they've been used.
Yes. So when I consent them for surgery, I specifically tell them that it's a minimally invasive approach, and most community members know what laparoscopic surgery is. And I tell them that the robot is still a laparoscopic approach with the added benefit of the robotic platform, which means that we have 10 times the magnification, and the surgeon has all of the autonomy over all of the arms. So there are less variables that are not in their control. So it just has a more streamlined dissection process. And usually when I explain that to patients, they're all for it, since they still have small incisions.
It probably gives the doctor more accuracy.
Yes, 100%, especially when you're dealing with very delicate vascular structures, biliary structures around the liver, structures around the stomach, the gastrointestinal tract. You can just see everything basically in 4D. It's almost like you're in the abdomen. So it's really incredible. Yeah.
Well, you've explained it so well. Thank you for going into such depth. I know everyone at the hospital is excited about this, the management purchasing it and bringing the latest and greatest to the Rio Grande Valley.
Absolutely.
It's quite a milestone.
Absolutely. No, I'm very excited to be a part of it. I knew when I finished my training that I wanted to, parlay into continued robotic surgery, laparoscopic and open. And so this has been a really wonderful program to let me kind of espouse all three in order to excel in patient care. So I'm happy to be here.
Great. Dr. Cantu, is there anything else you'd like to add? Anything I've missed you'd like to say?
Oh, no, other than just sort of, letting the community members know that this is an exciting time, and they no longer have to travel to other larger metropolitan areas like, San Antonio or Corpus Christi to have very modern advanced surgical techniques for their hernias or their gallbladders or other ailments. And we have those platforms now. And so we're now very much a premier surgical institution.